Stratification is the process of placing a patient into a particular category based on the severity of their conditions and the priority of their healthcare needs. This identification can be determined in several different ways, but a common practice is simply to count the number of chronic conditions a patient's been diagnosed with and assign a level based on that number. In the OnePartner stratification model, 0 to 1 condition are classified as low risk or L1. Patients with 2 to 5 conditions are classified as a medium or rising risk at L2, and 6 or more chronic conditions classifies the patient as a high risk or L3. We also have an L3 star category for patients that have recently been discharged, and they will hold this status for 30 days after the discharge. Oftentimes, we see the largest amount of spend coming from the smallest population of patients, and that's why stratification levels are so important. Across the nation, we see that 50% of healthcare costs come from the sickest patients, which account for only 5% of the population. These patients require an intensive, proactive approach to care management. The goal for these patients is to increase the use of lower-cost healthcare services in an effort to avoid expensive acute care situations. 30% of healthcare costs come from the rising risk categories that make up about 20% of the population. In many cases, these patients suffer from chronic conditions that are sort of on the fence, that move in and out of stability. The goal here is to extend services that will prevent the patient from moving into a higher stratification level. And the remaining 20% of healthcare costs come from the remaining 75% of the population. These are individuals that are mostly healthy or have easily managed conditions. The goal for this level of stratification is to treat as needed, but make an extra effort to keep them informed. Accomplishing this will prevent unnecessary and costly services. To that point, education is a powerful tool to help control healthcare spending. While emergency departments and hospital stays are sometimes necessary, the majority of cases could be handled in a much cheaper urgent care or outpatient setting. The average hospital stay costs over $10,000, and as you can imagine, depending on the situation, it could be much more than that. The cost of emergency room visits vary widely upon the circumstances, but average between $150 to $3,000, and sometimes as high as $20,000 for critical care situations. Dedicating an appropriate level of care and resources to each stratified population level not only reduces costs, but ensures that patients receive the right care for each situation. That is a truly remarkable system.